The purpose of this panel discussion is to situate the housing issues facing the older LGBTQ2S plus populations in the national policy debate currently underway in light of the recently released Canadian Mortgage and Housing Corporation National Housing Strategy. It's based on a SSHRC-funded project led by Jackie Gahagan from the Faculty of Health. This research project began earlier this year and has received quite a bit of national media attention. I want to congratulate the research team for all the attention you're getting for this important issue, so congratulations. So on that note, I'll introduce our first speaker. That's Liesl Gambold. Dr. Liesl Gambold is an associate professor in the Department of Sociology and Social Anthropology here at Dalhousie. Her current anthropological research is on aging and international retirement migration. Dr. Gambold has conducted research in Mexico among Canadians and Americans who have permanently migrated south, in southern France and Spain, which have been popular European retirement destinations for decades, in Sweden and Germany, where she interviewed residents at LGBT aging and housing facilities, and in Brussels, where she interviewed European Union officials about EU pensioner migration and health policies. Dr. Gambold is a research associate at Dalhousie's European Union Center of Excellence. Please join me in welcoming Liesl Gambold.
This research that I'm going to be talking about today sort of stems from research that I was doing previously on aging and mobility, migration, etc. And as a researcher, one of the things that I always find most exciting is when something surprising comes up when you're doing research. So one of the issues that became rather clear was that there was a subsector of this aging population, namely LGBTQ persons who had different issues to contend with in their aging, different from the other people who I had been doing research with. So that is, that's what helped head me into this direction. So the main sort of focus of the research interviews that I did was to understand how relocation patterns among older LGBTQ2 populations are negotiated and informed by health policies that can serve to influence access to health-related, healthy aging programs and services. This, as you heard in the introduction, was something that I was looking at in Mexico and in Europe. But then when we started talking about Canada, it became very clear that there were large gaps in not only our knowledge, but certainly in policy and support and discussion about this. Certainly the statistics show that this is an issue that should be discussed. The numbers both in Canada, the United States, Europe, clearly indicate that the aging / baby boomer population is significant, and that the portion of that population that identifies as part of the LGBT community is very much finding themselves outside of, current planning and support programs for aging populations. So I interviewed policymakers, care providers, housing officials, and residents in LGBTQ-focused housing and care facilities in Germany, Sweden, and in France. So that is where my data comes from. And so I'll just get right to my findings. We're sort of starting with, my case study, if you will, the data that came out of this, and then it'll be sort of contextualized more broadly with subsequent speakers. So the primary finding, of course, is that older LGBTQ persons have very few options in terms of aging in place amongst people who are also part of the community or who are at least open and accepting. If you think about it, standard, quote, retirement communities or retirement homes are not advertised as being uniquely heterosexual, right? But for members of the LGBTQ population who move in, they might very soon find that they have to keep their sexual identity to themselves. You know, when I said this to my mom, who lives in an assisted living home in Arizona, when I said, did you, like, was this a place that you thought was straight or gay? And she said, well, no one talked about that. And I said, well, exactly. So there's very little government support or widespread initiatives, and this means that members of the community have themselves been creating safe, sustainable, and supportive aging communities. Sometimes when these private and self-organized communities have become sustainable and well-known, the government takes notice. And that's when I've seen in my research that government or developers become interested in how can we get in on these pink dollars. So the EU seems to be leading the way in creating these spaces, but also the United States. And when I've talked to people in Canada, they're surprised. You know, the United States is doing this better than we are, by a long shot. So that was certainly one of the findings early on. And there are several policy reasons in terms of the EU and allowing people to move more freely with their pensions. So I went to Germany just to provide you with some of the core data, and then I'll conclude. I visited Lebensort Vielfalt, diverse living space in Berlin, and this was opened in spring 2012. It's a private venture, as most of these usually are to begin with, and it was the first multi-generational house with, as they describe it, a homosexual target group in Europe. There are 24 apartments. 60% of those are reserved for gay men over 55, 20% for women of any age, gender, or sexuality, and 20% for men of any age, gender, or sexuality. One thing that makes this particular place stand out from others is that there is an 8-room community apartment that is attached to the primary residence, where residents can transition to when they need 24/7 care. There's also a cafe restaurant on the main floor because the individuals who pooled their money to get this going wanted to be part of the community, wanted the community to come in. So it opened, and there has been and still is a waiting list of over 100 people who would like to move in there. Peter, who was one of the residents in the community apartment, said, one of the things that's so different here than a traditional nursing home is that this is our home. The house belongs to us, and when the caregivers come in, they're coming into our house. This is very important. We all pay between 400 and 450 euros a month, plus 200 euros a month for food. We create the menus, and most importantly, I guess why you are here, is that we can be as queer as we want and no one blushes. I have a daily outing with my handsome Hungarian-born caregiver, and we can joke in ways that I couldn't if I was living in a regular nursing home. That is important also. Our caregivers are all mostly gay or lesbian. The employment agency we use knows that we prefer this. So Peter was really reflecting on the amount of agency that residents have in terms of their environment and the caregivers in the in the small bed unit that's attached to the apartment. Jürgen talked about the fact that he would have been worried to live in a straight retirement community. He said, because even a straight old man might want to punch me. He talked a lot about his safety and being in a place where he didn't feel threatened by neighbors or others in the community. I also went to Sweden, to Regenbagen in Stockholm suburb, which was Europe's first exclusively LGBT retirement community. And it's 28 apartments. I interviewed residents there and the chairman, Christer Fahlman. And again, Christer and others who were organizing this apartment block were worried about how much uptake they would get in terms of interest. There's a waiting list of over 90 people. So again, I think we need to look at why there's so much demand and sustained interest in this kind of environment. Bjorn, one of the residents there, talked about how this center created an opportunity for aging LGBT individuals to provide not only a safe space, but to educate people. And they go out into the community, they talk in schools, etc. So their getting out into the community was as important as creating a safe and inclusive space. So again, to conclude, Canada is lagging behind the EU and the United States, and we need to do better. We need to create healthy and safe options for the aging LGBTQ individuals as well as the population in general. So thank you very much.
Dr. Jackie Gahagan, PhD, is a professor of health promotion in the Faculty of Health at Dalhousie University and a founding fellow at the MacEachen Institute. We're delighted that she is a founding fellow. She's a very, very active member of the MacEachen Institute community, and we're delighted that she's able to bring her research and help to organize panels like this. Jackie holds research associate positions with the European Union Center of Excellence, the Health Law Institute, the Beatrice Hunter Cancer Research Institute, and the Healthy Populations Institute. Jackie's program of health promotion research focuses on understanding and addressing health inequities faced among marginalized populations at the high risk for poor health outcomes through the development of effective policy and programming interventions. Prior to joining Dalhousie University, Jackie worked in public health at the municipal, provincial, and national levels in relation to harm reduction, HIV, HCV prevention, and tobacco use cessation. Please join me in welcoming Dr. Jackie Gahagan.
Hello, everybody. Thank you so much for being here. It's my pleasure to speak to you today about some of the work that we are doing around this complex issue called meeting the housing needs of older LGBT Canadians. And as Liesl pointed out, some of this work stems from earlier work that we did in the EU. My little tiny contribution to that was the sort of policy landscape review. But as you can see, Liesl has a lot of data that we can't possibly cover in the time allocated. So I'm just going to go through my presentation overview very briefly. I've got some key issues and definitions I hope that we can all wrap our heads around. Then I'm going to provide a very quick snapshot of some of the data from our online survey. I'm going to go through it very quickly, so I'll apologize in advance. It's going to sound like I'm just speeding through without caffeine. I'm going to speed through the data. But if you've got questions, please come and see me because there's a lot of data and it's important to share the data with you. So, and then finally we'll have some conclusions and next steps. As Liesl has already pointed out, healthy aging is a development and maintenance of optimal health, social and physical well-being, and function in older adults. That's a definition I think that's well known. What's less well known is that safe and respectful housing for older LGBTQ populations are not well incorporated into the existing policy landscape, and that, we believe, is a significant problem, particularly when we're talking about housing as a key determinant of health. Housing is a key determinant of health for everybody, but where it becomes more complex for older LGBTQ populations is around issues such as the effects of stigma, both past and present, and how that manifests in terms of older LGBTQ folks who may have come into the world at a time when it wasn't all right to be out, are now in some instances finding themselves going back into the closet. Keep in mind as well that this is the same generation of people who were told you have a psychiatric disorder called homosexuality, and that in fact homosexuality prior to 1969 was actually a criminal offense in Canada. This now manifests itself in fear in accessing health and community services, which includes housing services. We also need to recall the fact that many LGBTQ folks don't rely on their biological kin, but rather they rely on their chosen family for supports. And that's an important distinction because we know that older LGBTQ folks are twice as likely to be single and 4 times less likely to have children. We also know that many older LGBTQ folks rely on friends and partners who may lack legal recognition in terms of decision-making processes. We also have seen historically that LGBTQ folks have received unequal treatment under laws, programs, and services for older folks, and this includes the safety networks that we're all used to, may not actually include LGBTQ folks, and in fact this may lead to further stigma and discrimination. There's some interesting data coming out of a recent OECD report, so I'm not going to go into this in great detail, but you can read the caption to this figure where it says, there's still a long way before sexual and gender minorities meet full-fledged legal recognition. So I'm not going to go through those slides in any great detail, but you can kind of get it. You can eyeball the differences between the first graph and the second graph on this slide and see what an important legislative and policy toggle same-sex marriage has actually created in Canada. It's an important piece on the landscape to keep in mind. So despite improvements such as the recognition of same-sex couples, we can see, and Liesl has spoken to this, that Canada's kind of in the middle of the pack in terms of acceptance of homosexuality. What is kind of the good or bad news is Canada in some indicators is slightly above the US and the United Kingdom. But what I wanted to point out, and this I think speaks to Liesl's point, LGBT elder housing resources in the States are really rocketing, and we're kind of very quiet, very silent in Canada on that issue. So what's interesting is an organization called SAGE in the US has actually developed a lot of these sort of informational resources indicating which states in the US actually have LGBT-friendly housing. So this is actually something that we don't yet have in Canada, and I think that is a problem. And why this matters, just to use the US example, is that by 2015, we're going to see in 2015, we saw the launch of the SAGE housing strategy that's specifically looking at this cohort of aging populations whose needs are not being met. So by 2030, there'll be roughly 7 million LGBT elders in the United States, about half of whom have experienced housing discrimination at some point in their lives. Those are really quite telling data, I would argue. Now here we flip back to Canada. Important thing to keep in mind is Canada is the second largest landmass to Russia. So we have a giant landmass with lots of complex issues in terms of geography. But what's important to know is that for lots of reasons, LGBTQ folks tend to cluster in large metropolitan centers, Montreal, Toronto, Vancouver. So the issues for older LGBTQ folks who are aging in place in the Atlantic region, for example, may have fewer resources for this aging cohort. So in fact, they may not even be on the radar of some healthy aging policies or housing policies in certain, I'm not going to go into great details because we don't have time, but in certain provinces we don't even see any policies in place. So this leads me to talking just very briefly about the recently released National Housing Strategy, which is a 10-year, $55 billion plus strategy aimed at addressing two problems in the Canadian context. One is housing affordability, and the second one is homelessness. So these are two important issues that are, arguably affect lots of Canadians, not just LGBTQ folks, but as you saw in my previous slides, issues of social, economic, and other forms of marginalization have actually disadvantaged LGBTQ populations further. So just very briefly, in our phase one, and we are all co-investigators, we're all on the same team around this SSHRC, which is Social Sciences Humanities Research Council phase one partnership grant, where we've developed an online survey to capture just a very basic snapshot of some of the housing issues facing sexual and gender minoritized populations. The survey consisted of 69 closed-ended questions with the option of adding some additional open-ended comments. We had 787 partially completed and 422 completed surveys so far. It's still open, it's available in French and English. And the average age of our participants was 59 years of age. The data that we're collecting from the survey will be instrumental in terms of informing where we go with the phase two grant. But just for today's discussion, I'm just going to give you a very quick, very brief overview of some of the findings. So we offered two surveys, both are available in French and English. The survey that I'm going to talk about today is the one for those who selected that they're part of the so-called rainbow community. So I'm not going to be talking about housing service providers today, but I'm certainly happy to speak to you about that later. So here's a breakdown by province where people are currently located. No surprise that Ontario and British Columbia, although well done, Nova Scotia, we've got quite a nice response rate for folks living in Nova Scotia. We asked, what is your level of completed education? As you can see, most respondents have completed an undergraduate degree. When we asked for people to tell us their sexual orientation or romantic orientation, you can see most people identified as gay, queer, or lesbian. This is important because the rainbow alphabet keeps changing, and this makes it really difficult for policy folks and others working with these populations to sort of understand how to describe them or how to include them, probably more importantly. We also asked how people describe their gender identity and expression. You can see most people identified as cisgender male or cisgender woman. When we asked if the person has a disability, you can see there's a split between yes and no, but of those who actually said yes, they do have a disability, the vast majority report having an invisible disability. When we asked what is your yearly income, you can see most of our respondents had an income between $20,000 and $50,000 per year. When we asked where do you live, so city, town, etc., we see that most of our respondents live in cities. So we're putting another push out to get people from more rural and remote areas of the country to complete the survey. We've asked if people have had challenges in the past 5 years around housing, and if so, what are those? And you can see rising rent, housing unaffordability, and then a variety of other issues have come up. So of those who received who said yes, they have some concerns or some issues, we asked, how would you describe the importance of inclusiveness in housing facilities? And most people said, I don't really know. So again, I think we need to do a little bit more in terms of messaging what we do have in the Canadian context, not unlike our neighbors to the south. For those who describe that yes, they do have problems or have had problems with housing in the last 5 years, this is really, you can't read that, can you? No. Okay, so I'm just going to tell you that one of the big issues was I did not feel comfortable discussing my sexual orientation with staff or a landlord. So that was the number one issue that people faced. We also asked if you feel unsafe in your community where you live, which of the following is it related to? And people can choose more than one response category. But for sure, the first one is I feel unsafe because of my sexual orientation. We asked if living with other people from the rainbow community is important. You can see that most of our respondents said yes, very important or somewhat important. When we asked about the importance of community acceptance, you can see this was clearly something that was very important to our participants. We asked if staff and landlords who identify as members of the LGBTQ community are important for this conversation, and working with older LGBTQ folks, you can see very important and somewhat important was the most frequent response. And we asked if diversity training for staff working in the housing sector was important. You can see most of our respondents said yes, it's very important. We asked about the importance of anti-discrimination laws specific to the housing sector, and again, you can see most of our respondents said, yes, this is very important. When we asked about the creation of intergenerational housing for LGBTQ folks, you'll see from this that, again, most of our respondents said they felt this was very important. When we asked about housing programs for youth from the Rainbow community who are experiencing homelessness or are in care, again, this was seen as a very important issue. And when we asked, and this is important for all of you policy wonks in the room, because we asked, should the importance of data collection on sexual orientation and gender identity for people accessing residential care, which currently I would argue is not being done, or not being done particularly well, people are saying, yes, it is very important. So for those of you who are developing policies, if you don't have the evidence to draw from, there's a problem in the kinds of data I would argue that you're collecting to inform your so-called evidence-based policies. So to wrap it up then, I would argue that we need to improve our evidence base to inform policies and programs that help us meet the needs of this older population. The dearth of information on how best to open up the conversation about LGBTQ housing is extremely important. We need to engage with LGBTQ communities beyond clinical or hospital settings, which tend to be those that are most often accessible. And we need to start thinking about moving this conversation from a deficit model to an upstream approach around healthy aging and actually incorporate older LGBTQ folks in the development of healthy aging policies. And I think we can all agree, I hope we can all agree, that housing is an important health equity concern for older Canadians. So I'd like to leave you with this final thought. So educating people in encountering their unconscious bias is a key component of any policy package aiming to better LGBTQ inclusion. So over to you, the question is, how will your work influence policies, including housing policies for marginalized populations such as older LGBT Canadians? Thank you so much for your time.
Dr. Ren Thomas is an assistant professor at Dalhousie University School of Planning and also a founding fellow at the MacEachen Institute. We're delighted that she is. Ren's been very active at the Institute also. She has an MA and PhD from UBC School of Community and Regional Planning and is a registered professional planner and member of the Canadian Institute of Planners. Her research focuses on affordable housing and transportation, particularly policy transfer processes among practitioners. Ren worked in a variety of public, private, and not-for-profit settings, including the Ontario Growth Secretariat, University of Oregon, University of Amsterdam, Canada Mortgage and Housing Corporation, and the BC Nonprofit Housing Association. Her edited book, Planning Canada, A Case Study Approach, in 2016, introduces readers to planning and policy in Canadian cities and won the Canadian Institute of Planners Award of Merit for Planning Publications. Please join me in welcoming Dr. Ren Thomas.
Okay, thank you. So my presentation today is a little bit different from Jackie and Liesl's, I think. So transitioning over to this way on the spectrum, Shawn and I are going to speak a little bit more generally, potentially, on this issue. So my research and my work is mostly around housing and transportation policy. So, for example, I'm just finishing a study on nonprofit housing in Halifax, and I'm currently still working on a project that's comparing rental housing policy across Canadian municipalities. So those are a couple of the things I'm working on now. I'm also working on a book on transit-oriented development, which is based on some research I did in Amsterdam a few years back. So what I want to do today then is just talk briefly about kind of the specifics of how housing is actually developed in our cities and what some challenges are to supplying housing, especially for these kind of target demographics that we're talking about, such as seniors. And I'll focus a little bit more, obviously, on seniors today. So housing is of interest to, I think, a wide variety of professions. We certainly heard from the health side, from people that work in social work, as well as people who work in geography and planning and lots of other fields. So there's a lot of, when you look at housing research, it really crosses a lot of different perspectives, even people from, the real estate side, development side as well. In terms of our approach as governments, are providing adequate, affordable, and appropriate housing for Canadians has been a goal of our federal government for a long time. We had a Housing Act since the early days of the country, since 1935. After the war, we had our first National Housing Act, and that act specified the formation of Canada Mortgage and Housing Corporation. And since then, we've had a number of program approaches based on typically either housing quality, improving housing quality, or improving affordability of housing. and accessibility to those different types of housing through programs, typically funding programs that improve housing quality through renovations or build new housing or make sure that people have access through mortgages and those kinds of things. So in most countries, including Canada, planning for housing is a joint effort. So national, state, or provincial governments as well as local governments. That is particularly in part due to the fact that most of the time municipal governments, and this is true in Canada, have limited responsibility for housing, and they also have limited ability to generate revenue, so they have very limited taxation ability, whereas provincial and federal governments can, of course, run deficits, and that gives them a lot more leeway to establish programs. So we do have national planning objectives, so we have now the National Housing Strategy, for example, and then at the municipal level, they would be preparing housing forecasts and sometimes housing strategies based on their own population growth. And then developers in both the nonprofit and private sectors use these policies and programs to propose projects and build new housing. So if we look at the kind of, I guess, the levels of government and what they do at the national level, again, we have these national major priorities, and those are reflected in things like the Housing Act, the National Building Code, the new strategic planning, so all of those kinds of things. Those kinds of acts and programs really specify partnerships and funding agreements. So for example, right now we, through the federal government, Nova Scotia has funding through the social housing agreements, and that funds our nonprofit housing in the province. Those, right now, through the National Housing Strategy, there are bilateral agreements between the federal and provincial government. So Nova Scotia just signed our bilateral agreement in August, and now we have a 3-year action plan at the provincial level here, which specifies how we want to spend that federal money for the next 3 years. So at the provincial level, you'll see, again, some kind of policy priorities. So Nova Scotia has long had a priority to support seniors, and you'll see that reflected in a couple of programs. I'll show you that in a minute here. And then at the municipal level, again, we have housing plans or strategies if it's a larger municipality, or with the smaller municipalities, it'll often just be a section of their official plan. Depending on the size and the resources in that community, it will specify things like the demographic growth that's going to happen through obviously birth and death rates, as well as the number of people that are migrating or immigrating to that place. And it'll then identify the exact gaps in the housing supply. So how many new units do we need for families, for seniors, for people of different income groups, people with disabilities, those kinds of things. And then we have municipal bylaws and programs and policies, and those provide information on the specific land area within cities and the guidelines that need to be used to develop. So it might be things like you can only have certain areas are zoned for residential, single family housing, and other areas might be for mixed use. So that it might include commercial on the ground floor and then apartment units above, for example. So Jackie mentioned, and we've been talking about the National Housing Strategy. It was introduced a couple of years ago, mostly was rolled out in 2018, and now with the new Liberal minority here, we'll probably see a couple more programs from that roll out in 2020 now. So there's sort of 3, I guess, branches of funding or types of funding, either to create new housing, to repair and renovate existing housing, and then provide resources for community-based housing. And then, of course, part of it is to fund new housing research. So there's some specific goals that they've set in here, but you can find out more about that if you go to the CMHC website. And then this is a cost-sharing strategy as well, so it's the federal government providing half of the funding for these initiatives, and then provinces and territories providing the other half. So the most relevant programs for seniors in the new National Housing Strategy, I've just listed them here. So there's this National Co-Investment Fund, and that fund provides loans and capital funds for public, nonprofit and private sector developers if they want to build new housing. And there's also a repair and renewal stream which can repair existing housing. Then there's rental construction financing, so those are low-cost loans for up to 10 years for new rental projects, so that could apply to seniors who are still able to live independently. There's an affordable housing renovation fund, which provides funds for unique projects, and this is where I could see potentially something here with LGBTQ seniors. And then Housing Community Transformation Sector Fund and then Sector Transformation Fund is supposed to build capacity in the co-op and nonprofit sectors. And that is mostly some of that's being used for renovations, but it's also being used for kind of developing financial and kind of property management sides of these sectors, which are kind of lacking or which are weak. And for all of these funds, applicants have to meet some pretty stringent requirements around affordability, accessibility, and energy efficiency. So within the province here, we have two programs that specifically assist seniors. One is home adaptations for seniors' independence. So that allows you to make some adaptations to your particular unit or your house. You have to be an owner to access that. There's also the Senior Citizens Assistance Program, which provides health and safety kind of repair grants. So it might be something like plumbing or roofing, something like that, if you're a low-income homeowner. And you can, of course, also access public housing if you meet income and residency and core need criteria. So those are a couple of the programs. We're one of the few provinces that really has like targeted programs for seniors, partly because of that, as I said, that has been a focus of our province for some time. So some of the health implications of the national policy really is, in the National Housing Strategy, they take the approach that housing is a right, reduces chronic homelessness, it tries to improve housing quality, and it improves or is supposed to improve housing outcomes for seniors. And then another issue that outside of quality that people or municipalities particularly have dealt with is affordability. There's a number of reasons why affordability has become an increasingly, I guess, demanding issue. Unstable economy, increasing polarization of income. Most governments have been providing less funding towards public housing over the last several decades, and yeah. So some commonly used tools are I've just listed here. So for example, a lot of municipalities try to protect existing rental and affordable housing. They try to remove regulatory barriers to ensure that you can build a variety of housing types, develop incentives to make it more profitable for developers to actually build affordable housing. They might require developers to contribute to an affordable housing fund. And yeah, they might also try to create different zoning that encourages multiple family dwellings. So things like in our center plan, we have designated nodes and corridors for that. So there's a lot of different tools that municipalities have used, and in the study I conducted on rental housing policy across Canada, a lot of them are being used across the country. For example, one that might apply more to seniors is trying to make secondary suites much more easy to build. So the secondary suites could be within your house. So you could designate a basement suite or second floor or whatever as that apartment, or you could build a secondary unit, like an accessory unit behind your house, for example. And so that's something that we see being done to kind of gently increase density in these areas that were formerly zoned for single-family dwellings. And it does, the whole, in fact, one of the terminologies for them is granny suites. So one of the ideas could be that it could be used for an older member of the family to kind of have their own unit. So that's one example of a tool. There's my timer, and Tari also just gave me the time's up. So I'll conclude there, but just to, if you're interested in more of this kind of research around what municipalities are doing or can do to either improve quality or affordability, you can take a look at my website, and I have some research reports listed there. Thanks a lot.
Our next speaker is Shawn Harmon. Shawn Harmon is a barrister and widely published researcher. He's a lecturer in regulation and risk in the School of Law at the University of Edinburgh, UK. He's associated with the J. Kenyon Mason Institute in Medicine, Life Sciences and the Law, the SRC Center for Social and Economic Research on Innovation and Genomics, and the SSHRC Research Center in Intellectual Property and Technology Law. Please join me in welcoming Shawn Harmon.
That's a bit dated, so I'm here now, Dalhousie, and I'm with the Health Law Institute as well. So we're going to change gears a little bit again. So I'm going to talk very broadly about law and policy, sort of high level, and how we are thinking about sort of developing some of the phase 2 work that we're hoping to do in relation to this. And some of this is generated out of the very sort of rich data that come out of the empirical work that's already been done. And so I wanted to talk about, if I can find my slides. All right. This is what I'm going to try and get through. It's going to be very difficult in 10 minutes. I'm a lawyer. I can't clear my throat in 10 minutes. So we've already heard a lot of evidence about the challenges faced by elders in getting appropriate housing, and in particular, elder LGBTQ people. Of course, there's also other vulnerable groups that are identified in the housing strategy, and that we, of course, know have trouble with getting appropriate and adequate housing, and that's young people. And so I'm not going to go through all of this. You've already heard this. But this raised for us, and the fact that in our data and in some of the data that preceded us, was data about the utility of intergenerational relationships and intergenerational experiences. And so this raised for us this idea of the possibility of intergenerational justice, both as a lens to understand what is possible through the housing strategy, but also maybe to push that even further forward, and to think about how that strategy needs to work with other areas of law and policy in order to achieve this idea of intergenerational justice. Unfortunately, intergenerational justice is not a well understood idea. It has received quite a bit of traction in the ecological context, and this is some definitions that have been used in the ecological setting, but it's not really sort of well theorized in law. It hardly features in most of the legal theories that we use to justify our social and political and legal institutions currently, which are, you know, much more liberal. They're much more focused on atomism, on individualism, on self-interest. So there's this problem that we sort of have at the very outset of trying to define what it is, trying to sort of trying to fill it in, as it were. And what I'm suggesting here is that we can use sort of three values to give some sort of content or some sort of meaning to this idea of intergenerational justice, and I'll try to tie that to housing toward the end. The first is this idea of relationality, and this idea that society persists through time and across generations, and it is a partnership between those who are dead, those who are living, and those who are not yet born. And I think this is an idea that certainly Indigenous peoples appreciate a lot more than we do in the sort of modern contemporary policy setting. But this idea is that we have multiple relationships. Some are imposed, some are chosen, but they also impose on us or give to us multiple identities. And again, this is not something that's necessarily strongly featured in existing ways that we think about law. But this ties in, so the three values that I want to talk about are they definitely overlap and they complement each other. So this first one of relationality, and we can see how it's not sort of addressed well in law when we think about some of the main mechanisms we use. My background is in health law, so we think about some of the mechanisms we use in that context. It's consent we are concerned about, it's privacy we're concerned about, and there's some sort of talk in emerging discussion around relational consent, but again, it's not doesn't feature heavily in how we do things currently. So the next value is solidarity, and this is something I've been writing about for some time, and it's this idea that all humans are intimately connected through biology, culture, communities, and relationships. So you can see how it relates to relationality, but solidarity is a bit stronger because it's about connections with people who we don't have necessarily relationships with, other than that maybe we're all sort of human. And the idea is that connections impose obligations to care for one another and to bear burdens and to bear costs for one another. And so it's a bit more active. It's a bit more of an active thing than or idea than relationality. And the emphasis, as you'll see from the last bullet, is not so much on rights, which we are sort of very familiar with the language of rights. It's more about duties. And so the third one is responsibility. And it's recognizing that our polity, our community, our nation is an intergenerational agent that exhibits great inequalities and has breached its obligations to some people. And so we all, whether we're responsible or whether we have some blame in this or not, we all have a responsibility to correct the imbalances and to correct the harms. And to achieve a more just future, we have to adopt a sort of a shared sense of responsibility. And so we see things like in the, we all have a responsibility to contribute to reconciliation, for example. And this idea of responsibility, again, if some of our research has been in Europe, we see responsibility talked about a lot more in Europe. And in the health research context, health governance context, there's this idea of responsible research and innovation. And the idea behind that, which is advanced by the EU, is that research governance has to be a lot more anticipatory. And in order to be anticipatory, we have to engage a lot more people, a lot more consistently, a lot better in order to generate that evidence so that we can exercise foresight. And so this idea of responsibility is very important. And I think these three values sort of combined help us get a sense of what intergenerational justice could mean both generally and within the housing context. And so I've offered three sort of duty propositions for what intergenerational justice might mean. Because of time, I'm not going to dwell on this slide. I wanted to move on to the housing strategy and how intergenerational justice might interact with that. So the language in the housing strategy is actually quite positive. We see that it could support this idea of intergenerational justice as I've sort of explained it through these three values. And they talk about housing being approached as a human right. That's not traditionally how it's been approached. Talking about sustainable housing that will support Canada's climate change goals. Programs not negatively impacting on gender. Programs, helping vulnerable populations. So all of this sounds like it could sort of fit into an intergenerational justice rubric, but it acknowledges that there's significant knowledge gaps. And so part of what we've been doing is trying to fill some of those knowledge gaps. And of course, there are potential pitfalls in how the National Housing Strategy might be applied. And I want to talk about two of them really quickly. But first, I wanted to just say something about how intergenerational justice then might relate to housing in particular. So again, four sort of propositions is how I've structured it. One is a rights proposition, one is a duties proposition, one is a balancing proposition, and one is about futures. And so the right, which we've already talked about, I think the right to housing that facilitates good health, accommodates physical limitations, supports emotional well-being, and encourages continued social interaction. I think that's a richer right than what we typically sort of approach this area, which is more sort of four walls and a staircase. The next thing is duty. Given the historical egregious approach that public entities have taken toward the LGBTQ community, there's a duty to support them in their special needs at the end of life. But then this third thing is really important. It's about balance. So meeting the needs of the older LGBTQ community shouldn't detract from the needs of the younger LGBTQ community and, of course, the younger people generally, who also need sufficient, appropriate, safe, and humane housing. So there's a real important element within intergenerational justice of balancing rights and interests and finding commonalities. And so then the last one is this idea of future. So given the sort of the profound ecological disruptions that are currently underway in the Anthropocene, we have to ensure that housing develops not only have stringent sustainability standards, but also anticipate local geophysical challenges and build toward them. So it's no good building really good intergenerational housing that in 30 years is going to be 2 meters underwater or something like that. And so I don't think I actually have time to talk about these in any detail. But one potential danger with the housing strategy is that it will be approached in silos. And so groups will be considered discreetly as indigenous, as gay, as youth, and ignores how individuals hold multiple identities. And so housing will be considered also discreetly, ignoring its interactions with other social determinants of health. And I think if we think about intergenerational justice, it gives us some answers to how we can try to avoid that from happening. And the other danger has to do with rhetoric, and so the stipulations in the strategy might just end up being rhetorical, and the government's approach to housing and to the LGBTQ community won't really shift from the poor foundations that it's been built on in the past. And, you know, if we think about Canada's housing policy for the last 30 years, has been advanced by a profoundly neoliberal, market-driven agenda. And when that agenda didn't deliver what they wanted, they tried more from that particular agenda. So looking at intergenerational justice might allow us to think a bit more about how housing can be humane, and it reminds us to look at it as an intergenerational investment and not as a sort of a market-driven outcome. I'll end there. I'll leave the conclusions up on the screen. Thank you.
Thanks so much for coming. Please join me in thanking Liesl Gambold, who had to split early, Jackie Gahagan, Ren Thomas, and Shawn Harmon. Thanks so much.